There are exciting things happening here. I'm so excited to once again be joined by Dr. Wayne Blunt here from Dedicated Senior Medical Center. And this morning we're going to talk about something very interesting, which we haven't really delved into yet, and it's the importance of having a primary care physician.
Yes.
Why is that so important, especially for our seniors watching this morning?
Well, you probably have used medical care in the United States recently, as most of our seniors have, and you probably know it's not coordinated. You'll go from one doctor and they'll send you to another doctor, and then you'll end up in another doctor's office. And especially for seniors, you might have 8, 9, 10 doctors out there that are providing that one patient care. And one doctor is prescribing one medicine, another doctor is prescribing another medicine, and they don't communicate.
Yeah.
And one medicine may not work with the other medicine. And if you've got a primary care physician that's, excuse this phraseology, but quarterbacking the situation, they can quarterback the patient throughout the game. And so I know as a primary care physician that you're going to the cardiologist. And I know that I need to hear from that cardiologist to see what is it that you're recommending for my patient. And if you're going to go to a lung doctor then, a pulmonologist, I'll know that too. And because I sent them there. And then I will know what medicines they put them on. I'll be able to know if the medicines are compatible.
Which is a serious issue here in healthcare, with doctors not communicating in those adverse drug reactions, correct?
Without a doubt. Again, many of our elderly patients, and if you're listening out there and you're elderly, you know you could be on 15, 20, I've had patients on more than 30 medicines. And they come in, and we know for a fact that if a patient is on 8 or more medicines, they are going to have an adverse drug reaction 100% of the time.
Wow.
So we can't just give patients all medicines willy-nilly without knowing what they are and what they can do to the patients. And if you look at things like the guidelines, and a lot of physicians use national guidelines now to practice medicine. There's only 2 guidelines out there that I know of that consider how to treat a patient with that illness when you consider the other illnesses that they might have. And that's, so if you've got a hypertension guideline that says, here's how you bring the high blood pressure down. Use this medicine, this practice, but they don't consider what other illnesses this patient might have. If you're diabetic, the diabetic guidelines do that. If you have atrial fibrillation, the atrial fibrillation guidelines do that. If you don't have either of those 2 illnesses, you're just left to not knowing what you're going to get.
Which is scary, which is one of the reasons why I say there are exciting things happening here, because I feel like your team is really taking it a step further, taking healthcare. This is where the future maybe should be for patients, and it's about building that relationship and making sure you have an advocate here who's putting those pieces of the puzzle together, correct?
Relationship, you hit the nail on the head. So many people view coming in and meeting their doctor because they're sick and having that time with their doctor, they view that as a transaction. The doctors view it as a transaction too. It is not a transaction. It is a relationship. And that's what we do here. We concentrate on relationships. And in that regard, what we think we do here is we try to provide, and we honor our seniors by providing affordable, VIP healthcare that produces better health. And we pride ourselves on showing our patients 3 big values. That first value that we have that we want our patients to see is love. We love our patients. We not only love, we like them. We like people, you know. We have passion about it too. We have passion about what we do, and we are accountable. We hold ourselves accountable for improving the health of our patients and doing it in an affordable way.
You can't tell he's passionate at all, right? Doctor, thank you so much for allowing us to be here. Again, exciting things happening here. I'm excited to see where this continues to grow, maybe new locations here throughout the years in the Bay Area.
Definitely.
Again, seniors need to check this out if they haven't yet already.
Thanks
so thank you so much, Doctor. If you would like any more information, just head to our website, tvmorningblend.com.